There is a summit that's planned. The date and time hasn't been confirmed yet. For the Republican leadership, Democrat leadership, and the president to all sit in the same room together and see if they can come up with something that it can pass. I think it's ironic that a bill's going to be submitted before the meeting, but just my observation. And that's where that goes. Cap and trade, even though it passed the House, I think it's completely dead and buried in the Senate. And what the Senate's going to do, what my prediction the Senate will do is a clean fuels bill, where they'll talk about renewable energies, more incentive, or at least continuation of incentives for wind power, solar power, clean energies. There will be a nuclear component to it, and call it a day. And that will be their clean environmental bill. And they'll get that passed. That'll probably pass with 80 votes, maybe 90, something like that, and probably with about the same percentage in the House too. On the consumer protection, financial protection bill, Chairman Dodd has said that he doesn't like the big agency with that much power, and that they're likely to work with existing government entities like the FTC and maybe give them more instructions on how they're able to review financial products and advertising and things like that. With that, that ends my overall review of the year in the past, and at least those that are being teed up for this year. One additional thing that may generate some discussion is Speaker Pelosi did say that one of the bills that she wants to do this year is the immigration reform bill, as it's being called. It has two components to it. One is the pathway to citizenship for those that are undocumented here now, illegal, undocumented, and an employee verification mandate. There's already one in law, but this will beef it up, create a new system, and that's it. So if you wanted a bill, if you wanted a immigration bill that dealt with border security, that will not be part of the bill. Now, my personal opinion, I don't think they'll bring it to the floor because of politics. I said to a reporter when I was asked right after Speaker Pelosi made that announcement, I said, I understand why they want to bring this forward. It's a base constituency for them when they're concerned about the elections in 2010. But I think it's a dangerous move for them. I think they'll end up doing by that is solidifying their minority status, or virtually guarantee that they'll lose the House if they do that.
I said Pelosi was headed somewhere else and planet Earth got in her way.
Yeah, basically. That's very articulately said. So that's the one other thing that has been said that is on their agenda. Otherwise, that's all that's been advertised to us. So with that, let me open it up for questions with the gentleman in the blue tie and blue shirt.
Taking it back to healthcare. What I really, there are too many people who are not covered. There are too many people who are vulnerable to losing their insurance, have caps if they get really sick. So we have to do something.
Yes.
You're talking about, making this pool available to everyone, and that may bring down the cost, but there's going to be a certain percentage of people who are working 3 jobs and et cetera, and are still not going to be able to afford that insurance. Because you're not going to bring it down that much. What provisions do you have for that group of people? Because the major thing here is to be making sure people have coverage and they can keep it. What about pre-existing conditions? I'll just leave it at that.
Very good. No, it's a good question, and frankly, there's so many components in there that I may not, it would probably take me 20 minutes. But let me go through it. First of all, we all want to do something. And I do think, even though this particular bill that was agreed upon by Speaker Pelosi and Majority Leader Reid, I predict isn't going to go anywhere. We all agree something has to. Pre-existing condition exclusions is something that 80–90% of us agree on. Those are bad. They shouldn't be in there. The reason why insurance companies don't want to unilaterally disarm is it gives the one that doesn't a marketplace advantage. And so it has to apply to all or none for it to work. And that's why Congress may have to intervene on something like that. Hold on just a second. So I do feel confident that there's going to be something that's done. And what do we do with that? The group of people that still won't be able to afford? My view is once we get this new infrastructure in place, where we're able to lower the cost, allow individuals to get into a pool that's not an individual market of one, which is outrageously high, and I agreed with President Obama when he said in a speech to Congress on health care that type of plan like I laid out would be 60% less than if you had to go out and buy an individual policy in the market today. It's probably a good 20 to 30% less than most employer groups, just because of the sheer size and the competition. So let's get that infrastructure set up. If there's people that don't have access, then we can deal with that in a variety of ways. Maybe it's premium support payments or something like that. We can help them out. But let's get that infrastructure in place today, because the cost of the program as it's designed right now and the impact overall is bringing it down. You no longer have the public support for that. So we have to go back, create that infrastructure that has great support, and then let's move on and see if there's people left out or how many, and deal with them.
But why wait? Why not build it into, and I'm a physician, I've been studying this for years. There's going to be a sizable percentage, I work in Northo, who are not going to be able to. I don't care, you cut it by 60–80%. Why don't we build it into the bill from the beginning so we get the people covered?
Well, that's a great question. I think a fair question in the sense is that's why we're getting up to $1.2 trillion, is because I think we're estimating how many people that would be. And of course, when you aren't when all you're doing is rearranging the chairs and not doing anything to bring down the overall cost of health care and the access to health insurance, you're going to spend the $1.2 trillion. Let's get this set up. Let's figure out how many people. Then let's have a discussion about the best way to get them in. Let me ask you as a physician, and this is not meant to be a bad question, but the quality of health care, but most people at poverty have Medicaid, and that won't go away. So you're talking about a group above that. Do you perceive that they are being denied access to care right now?
Absolutely.
Even with the Charles Drew and One World and
not near enough of them exist.
Okay.
They're overwhelmed already, and we'd be talking about
so
10 times as many people as they see now, easy.
Yeah, I think it would actually, under a system like I laid out, bring more people into the insured. So
I'm compensating for that.
Yeah. Have a respectful disagreement on that.